Hello, my name is Jeanette Cadell, and I am here to present my comprehensive teaching plan to manage diabetes type 2. Population of interest. My population of interest are those 45 and older. In Marion, Alabama, the population in 2014 was just over 3,400. The issue of concern is type 2 diabetes, but there are also several other types of diabetes. There is type 1 juvenile diabetes. Type 2 is usually considered on adult onset diabetes, and then there's gestational diabetes. Type 2 diabetes is when the body makes insulin and the body does not respond to it, or the body doesn't make enough insulin. According to Healthy People 2020, diabetes affects an estimated 29.1 million people in the United States, and it is the seventh leading cause of death. The 5 roles of the APHN. There is the researcher, the clinician, the educator, the collaborator, and the advocate. According to Healthy People 2020, the goal is to reduce the disease burden of diabetes mellitus and improve the quality of life for all persons who have or are at risk for diabetes. Usually physicians like to see in hemoglobin A1C less than 7. So this is a good number for your diabetics to stay around. Social determinants to diabetes are access to proper health care, availability of resources to meet daily needs, availability of community-based resources, and support of community living and opportunities for recreational and leisure time activities, social economic conditions, language, and literacy. And this is from Healthy People 2020. So some interventions that the APHN can do in combating diabetes mellitus. The clinician can make an assessment of the community. They can determine the need for a educational plan. They can develop this plan and implement it, and then they can set goals. The collaborator, they can meet with the community leaders. They can formulate a plan of care for the community. In addition, they can reach out to healthcare providers for consultations. The educator, they can form health fairs. They can give out handouts in the community. They can also formulate a plan with other healthcare professionals. The researcher, they can do a literature review. They also can formulate a new plan of action. They can collaborate with other healthcare professionals to develop and implement that plan. Advocacy. This is very important. Speaking out for the patients and on the patients and the community's behalf. They can engage the community leaders to develop plans to assist the community with combating diabetes. Literature review. According to the CDC in 2015, more than half of the new cases of diabetes type 2 were among adults aged 45 to 64 years of age, and it was equal between men and women. Modifiable risk factors. Overweight or obesity. These are things that you can change. So being overweight or obese, smoking, heavy alcohol consumption, being inactive, and consuming a diet high in sugar and carbohydrates. Non-modifiable things that you cannot change that will predispose you to diabetes. Family history, your age, race, and ethnic background. These are some scholarly articles that were reviewed to come up with to prove that there was a problem with diabetes type 2. So with the first article, they chose people who were at risk for getting diabetes, so pre-diabetic, and then those that were already diagnosed with type 2 diabetes. Article 2, they had 2 groups. They found that diabetes type 2 was higher in men than women in this study. And the third study, there were 869 participants, and out of the 869, 190 of those participants were diagnosed with type 2 diabetes. So primary, secondary, and tertiary preventions. Primary prevention, you want to promote exercise, a healthy diet, and weight loss. Secondary, you want to continue on the primary and add in a hemoglobin A1C, fasting glucose, and a glucose tolerance test. Tertiary prevention, this is where you would have to bring in medications to treat the disease. Effective roles for the APHN in preventing and developing a plan for diabetes. The researcher, detailed literature review. The clinician, they can assess, develop a plan of care, and implement this plan of care. The collaborators can collaborate with other healthcare providers and help community leaders to develop a plan and implement this plan. The educator, they can host educational seminars to make the community aware. The advocate, they can speak out for the individuals that are diagnosed with type 2 diabetes. Nursing theory. The nursing theory that I chose was Virginia Henderson theory, the definition of nursing. When I reviewed this theory, I noticed that her theory basically cared for the whole patient. So holistic approach for care, spirituality, emotionally, socially, physically, and intellectually. So all of these things are needed to care for a patient with diabetes mellitus type 2. Summary of needs assessments. All levels of prevention should be addressed when dealing with a person with type 2 diabetes. This will assist him to possibly lower their A1C, get their weight under control, and maybe possibly come off medication if need be. Priority educational plan. So like I stated before, the primary prevention would be priority. So I want to teach them about exercise, teach them about weight control, teach them about healthy eating. The proposed plan, the participant will exercise for 15 minutes a day, any kind of exercise until 45 minutes, till they can reach 45 minutes for 5 days. Eat a healthy, balanced meal 3 times a day with 3 snacks in between each meal. And if they're overweight, there should be a goal to lose at least 2 pounds per month until a healthy weight is achieved. These are some handouts that I used during the presentation to present to type 2 diabetics. The one in the corner just to give you a little bit of statistics for diabetes. The middle one with the plate is the healthy plate. You should want to have less starchy foods as possible. Go with more whole grains. You need your protein and vegetables. And you want to drink skim milk or 1% milk, not whole milk, because of the carbohydrates and fresh fruit. I also educated patients on diabetic foot care, to look at their feet daily. Also talked about signs and symptoms of hypoglycemia and hyperglycemia. So summary of geographical location. Marion is the house seat of Perry County. And it is located in the Black Belt area. And this area has many fast food restaurants, which could be the cause for the high incidence of diabetes. The local government structure, they have a mayor. He was elected in 2018. Key leaders, Frances Ford, she works at reaching out to the community. She's a community health nurse. So she reaches out to the community and she has a support group. The U.S. Congress representation, Doug Jones is the senator. Congress, Terry Sewell represents Perry County. Rep. Howard is the representative in District 72. Health policy is very, very important. Nurses should always get on health policy boards to help figure out ways to make healthcare better for the state, for the states, and for its people. Again, health policy, social determinants to diabetes type 2, access to care, available resources, community and family support, economic conditions, language and literacy, code of ethics. ANA developed 9 code of ethics that all licensed nurses should follow. Nurses should ensure a positive nurse to patient relationship. And this is health policy advocacy. Demographics, as stated before, population for Marion is about just over 3,400. Majority of the population being African American, and the next race being Caucasian. Majority of the community works in or just on the outskirts of Marion. The income per capita is $12,447. The educational levels of residents, so like I said, they have a production company in the city that hires some of the city. Diabetes counts for 61,458 out of the incidence and prevalence of major chronic diseases. This is the crime rates and child abuse incidents for births. The windshield survey. Marion does have 3 small family care clinics. They have a grocery store, a drugstore. Obesity accounts for 45% in the city. Dr. Lee, he's one of the physicians. He's the head physician at Marion Clinic where I did my preceptorship, my clinical practicum, and he states that Marion needs an urgent care for after-hour care. Miss Frances Ford is the community health nurse. These are the 3 primary priority community diagnoses. The primary community diagnosed risk for unstable blood glucose level related to deficient knowledge for diabetes management plan, as evidenced by 80% of Perry County residents participate in diabetic monitoring. This is the feasible population intervention. The measurable plan objective. At the completion of the teaching project, the patient will be able to define diabetes mellitus type 2, understand how diabetes mellitus type affects the body, identify ranges of normal blood glucose and A1C, identify an exercise regimen, identify foods to consume and eat in moderation, identify levels of prevention, demonstrate how to monitor blood glucose levels, demonstrate how to administer insulin if need be. Detailed plan for intervention. They will document their blood sugars, their exercise amount, and their food intake. Exercise for at least 15 minutes a day. Consume at least 5 fruits and vegetables per day. Limit fats, beef, and pork in diet. And they will need to come to the clinic at least every 2 weeks to weigh in, get vital signs, and get a blood glucose check. Finally, at the end of the implementation, they will need an A1C drawn to see if everything was effective. And my preceptor usually has the patient come in at least every 3 months. Potential resources: conference room, presentation equipment, journal, printed material, blood glucose monitoring, syringe and vial. Barriers: patient literacy, which was a problem, non-compliance of patients, declining health, student anxiety was often seen in the clinic. Team members, the patient's participation is major because this is for them. So getting them to participate is very needed. The physicians to get on board and the staff members needed to check their vital signs and get their weight and blood glucose. And family members, their family support. These are key stakeholders. Some future recommendations: health fair for individuals with type 2 diabetes. Longer implementation time for monitoring progress and A1C. Continuation of the educational project and have it done in other facilities. I think this would be a great project to implement in other facilities to combat diabetes because it's such a brutal disease. So that is the end of my project. I hope you all thoroughly enjoyed it. Thank you so much.